what we do individually in terms of getting vaccinated, staying home if you're sick, being very careful around our gatherings, following all the protocols, including mask use, can change the trajectory. So, behavior, our individual and collective behavior is a key component, and that is to some extent impacted by government orders. But, we've always worked hard and, we've pulled together, and, it's been a divisive time many times, but I think in the past there's mentioned that Dr. Shahab just pleads to the public and he doesn't direct an order, but I have no shame in pleading to the public that we've gone so far, and we just have to pull along for the next few weeks and months, and it is distressing to see what is happening in our ICUs and hospitals, and I'm sorry, it's a very challenging time. Thank you.
No, that's okay. This wasn't the question I was planning on asking, but Dr. Shahab, are you okay?
I think I'll take a minute with some.
No, take all the time you need, please.
So I just say that all the evidence is out there, and it is very distressing to see unvaccinated, young, healthy people ending up in ICU and dying. I'm watching this from a distance, but the pressure this puts. We talked about burnout. Derek talked about burnout on staff. To see young lives lost through a vaccine-preventable disease. How can we accept this in a country where we've had vaccines available for everyone ever since July? So again, the fact that even the small proportion who remain unvaccinated are generating enough cases. And first of all, these are individuals who are not just being hospitalized or being shipped out. There are friends, family members who are getting sick and dying. And of course, the other impacts of delayed care. So again, apologies if I'm being a bit unprofessional, but it is very challenging because we all want this to be behind us, and it won't be for many months for other reasons, and we'll have to look at booster doses and other precautions for the next little while. But right now, I think we have an opportunity, as the modeling shows, as scenario number 5 shows, by reducing our contacts, getting as high a vaccine uptake as we can, and just being careful in our social contacts, and we can turn this around, and we've done this again and again. Public health orders help, but ultimately it's been our collective and individual actions that has turned things around.